Hi, I'm Dr. William Lau. I'm a board-certified plastic surgeon in New York City. The purpose of this video is to give you information to prepare for the upcoming consultation. This video can also allow you to review the material that we will talk about at your own leisure.
So breast augmentation is one of the most commonly performed surgeries in the United States. There are typically three approaches you can choose for breast augmentation. The most common popular approach in Asia, which I also specialize in, is through the axilla, so-called transaxillary endoscopic approach, using an endoscope to aid your dissection and also allows almost bloodless dissection. The other approach in the United States is go through the IMF, the so-called inframammary fold, right below your breast. This approach is also very good, but it has a more obvious scar. The other one is go through the areola. So we make a sort of 180-degree incision around the areola and put an incision through that way. I think the best approach is either the axillary approach or the IMF approach because study shows they have less complication rate and also lower capsule contracture rate. Through the areola is also a good approach, but maybe a slightly higher chance of capsule contracture or a nipple sensation change or infection, just slightly higher. So those are the three most common approaches that's offered in our practice. So those are the three most common approaches that's offered in our practice. So the risk of breast augmentation is similar risk with any other procedure. There's always risk of bleeding, infection, injury to surrounding tissue, or need for revision. But the risk that you should really know about is something called capsule contracture. So what is capsule contracture? Anytime you put an implant, it can be a breast implant, chin implant, or nose implant, any kind of foreign body inside your body naturally forms a capsule to wall it off because it knows it's a foreign body, and that's normal. So everyone who had a breast augmentation will have a capsule. But capsule contracture is describing a phenomenon when you have some bleeding, some infection, or the gel leaks out and touching this capsule, or sometimes just purely genetic, that the capsule becomes very thick and hard over time. It has no real overall health problem to your body, but it will feel very hard and the shape could change. So that is actually the most common reason for second-time breast surgery after breast augmentation. And there's different implant also shows different profile. These both are very good FDA-approved implants. Mentor implant, much softer, and typically, I would say lifetime risk about 10 to 15% of capsule contracture rate. This is called the Motiva implant, which was recently approved by FDA in last September, and then current data shows about less than 1% of capsule contracture. So these are the current implants that we use often in our practice. To help you select the best implant for you, when you come for a consultation, we will first measure out your breast to know the dimensions of your breast, and then we'll use a 3D simulation system, which can allow you to see what a 200cc, 300cc of certain type of implant will look like on your body. And I find that the most rewarding experience for the consultation because oftentimes they can only imagine what implants will look like what on their body, whereas the 3D simulation system will give you a very clear image of what that might look like, and I find it pretty accurate. And we also have multiple samples, implants of different sizes that you can even try it on your own bra. So many people wondering about the recovery of the surgery. Surgery usually takes about 2 hours, and then you can go home the same day, usually no drain. And the pain-wise is very subjective. We have patients, actually multiple patients, who went out and eat with their friend the same night. We also have patients who feel more pain. And the pain is more of a tightness kind of pain from the sudden volume increase. But most people are very well tolerated. And then we'll give you pain medication as needed, so you just take it. Typically, after the first 3 days, everyone feels pretty good. So in terms of time off, I would say most people would take about 3 to 5 days or even a week of time off from work. But usually no one takes more than a week from work. So our typical follow-up schedule is the first time is at 1 week after surgery, and then 1 month, 3 months, 6 months, and 1 year. And typically everything looks great in 1 year, I just let you graduate. And then it takes most people, I would say, about 1 to 3 months for the breast to look natural. Initially, after surgery, in the first week or two, it might look really high because of the swelling and also the implant hasn't settled. But after about 1 to 3 months time, you will look very good and it become more and more teardrop shaped. The other form of breast augmentation, which has been very popular recently, is the fat grafting to the breast. So it's kind of like killing two birds with one stone. We can take fat from areas of your body that you don't want to put it in your breast. And we can also put it in your face or your butt. But it has its own set of benefits and issues as well. Benefits, like I said, killing two birds with one stone, you'll remove fat from places you don't like and put it in your breast. And it also can give you a breast augmentation without a foreign implant. But the result is more unpredictable. Meaning if I put a 300cc implant into your body, I know I can get a 300cc result. If I put 300cc of fat inside your breast, it's hard to know how much of the increase you'll get because usually more than 50% of the fat you injected will be absorbed. And there's also additional potential side effect like oil cyst, fat necrosis, where you have some lumpy feeling. Those are potential risks of fat grafting. So it's best to come and talk to the doctor and then to figure out what's best for you. And it's also possible to do a combination approach where you can put breast implant and some fat grafting in the surrounding to make the contour even looks more natural. That's also an option.